Hi, this is Kim from Complete Balance. In this session, we're going to review Torticollis or Wry Neck. It's where the neck is rotated and the chin is dropped. You're unable to straighten the head without an awful lot of pain on this side. Can be, as I said, it can be extremely painful and quite limiting because you can't turn your head, look over the shoulder to drive the car. A condition that often manifests itself through either scrunching your neck up when you've been asleep or sitting in a draft, should I say, a cold draft, and the neck stiffened and shortened, car accidents, whiplash injuries, that kind of thing. Babies are often born with or can be born with issues with torticollis where they've been scrunched up in the womb and the neck's been held in a certain position. With any neck issue, if you've got numbness and tingling down both arms, or you've got any acute pain in the neck, any migraines that are so debilitating you're having to go to bed, it's always worth just having a quick run through with the GP to make sure there isn't any other underlying issue with the cervical spine. Before you approach any of these kind of soft tissue injuries, it is always a good idea to heat the affected area up. So a hot water bottle or a wheat bag on both sides of the neck prior to treatment will give you good results. It will soften the tissue, warm the area up, so allow you to get into it a little bit more. Torticollis is usually a shortening of a muscle called this SCM, sternoclavicular mastoid. I'm going to make it pop out in my neck. So you can see there, it starts at these bony bits and then runs all the way up to my jaw. It's also heavily implicated in jaw issues. So generally this side, one side will have shortened and got very tight and very painful. Now, as you can see with my fingers, my SCM is nicely soft, so it doesn't hurt me to grab hold of it. But you can actually hold it with your own fingers. So you're gonna work on both sides. I would start with the affected side first, and I would get the sort of hand into a bit of an L shape and use this line of the index finger. And you're going to find this sort of knobbly area, and you're going to slide the index finger knuckle on top of it. And then you're going to take the other hand on top. And then you're going to have the intention of drawing the tissue down or the skin down. So you're going to push it in and then draw down towards the belly button. And as you do that, you're going to attempt to try and straighten the head. And the movement may only be a couple of millimeters. It may only be a very tiny movement. So don't worry if it's just a small movement. You're trying to set the intention because there's a spasm there. And you've got to recondition the brain to understand actually it's safe to straighten the neck. So you're just going to gently, so I'm going to take my hands off. You're kind of looking for that movement. So if you're like this, you're trying to take the head into that movement. Then you're going to take this index finger and you're running along the line of the collarbone. So this top finger is actually on my collarbone. And then I'm going to use my other hand to push in towards the chest and then draw the tissue down. So I'm going to stick my head into this kind of position. And then I'm going to take my head up. Again, you're just trying to lengthen through this area. And you can do this all the way along. It gets a bit more tricky the further away you come. You can use the hand on its own. You just want to get hold of that collarbone and then draw the tissue down towards the hip. So you're always trying to take it down as you move or right the head up. And you'll feel it starting to stretch that whole area, and it's getting into some muscles called the scalenes, which can also be a challenge. So you're working away along here, and I would do that 3 times. If you get to an area where it's particularly sore, try and back off the pressure. You don't want to go over a 6 out of 10 in pain. You want to get to a point where it's sort of 5 out of 10, and you can just wait and hold. So you can hold that position and wait 30 seconds to a minute, and that pain will ease off. Unfortunately, when the brain gets involved, because it feels safe in this twisted position, it's not going to allow you to straighten the head unless you challenge it a little bit. Okay, so you can wait and hold 30, 40 seconds or working along that line. Then you can use your thumb and your index finger to find this bony bit and then find that SCM. Now, you may not be able to grab hold of it as easily as I can with mine, but you want to take as much as you can and just gently twist it, just gently move it. You can take the fingers, you can slide it up and down as you would slide the fingers up and down a rope, and just gently teasing it. It's likely to feel quite sore because there'll be some trigger points. It'll be the muscles will feel quite tender in this area. So just do what you can, remembering not to go into a lot of pain. And then you start to use this finger and the thumb, and then you work up the SCM, and you'll go aiming towards the jaw, kind of all the way up to here. Getting hold of whatever you can, and then just gently twisting it. You can pinch it, or you can take the fingers up and down. Just some gentle movement. It wants to be quite slow. This is not a game, something that you can be rushed. This takes time. And then you're going to work all the way up, and the closer to the jaw you get, it widens, so it becomes a bit thicker. Just moving it all the way down. Now I'm doing this quite quickly for the sake of the video, but each one of these will take 30 seconds to a minute to complete. And you can do that 3 times. And I would also do it on the other side. I would do this action on the other side as well. And then to finish, depending on whether you've had some movement, whether the neck is straightened up a little bit, I would take this index finger again, bring it over these 2 bony points, take the top hand, push it into the chest a little bit, and then try and draw the neck up. So you're taking the tissue down towards the navel and drawing the neck up. So the action is always to take the head back into a straight position. So if I was to come into here without anything, I want to take the head up this way. So apply the heat again after that. And then once you've got the neck back up into a more vertical position, then stop doing this action and then go on back onto my YouTube page and look at some of the upper shoulder mobility work. There's quite a lot of work available that you can do with tennis balls against the wall, because you're also going to need to get into these scalenes and to the suboccipitals, which are at the back of the neck. But until you've got the head righted, it's going to be difficult to get into that. So get a couple of tennis balls, something that looks like this in a sock, and then you can take it against the wall. But there's lots of videos on my YouTube page that take you through things like that. Any questions, do email me at info@completebalance.co.uk, and I look forward to hearing from you. Thank you for watching.